Do you know what uterine fibroids are? If not, you're in the right place. Uterine fibroids are non-cancerous growths that spring up in or on the uterus, the female reproductive organ where a baby grows when a woman is pregnant. These growths, which are also known as myomas, are not typically associated with an increased risk of uterine cancer, and they rarely develop into cancer. They can be as small as an apple seed or as large as a grapefruit. Some women have just one fibroid, while others may have many. Each woman's experience with fibroids can be dramatically different. They can cause a range of symptoms, or none at all. It's estimated that 3 out of 4 women will have uterine fibroids at some point in their lives, but most are unaware of them because they often cause no symptoms. By the end of this video, you will understand what causes these growths, their symptoms, and how they can be treated. So, what causes these uterine fibroids, you might ask? While the precise cause isn't crystal clear, there are several factors believed to play significant roles. First up, let's talk about hormones. 2 hormones that stimulate development of the uterine lining during each menstrual cycle, estrogen and progesterone, are considered major players. Fibroids contain more estrogen and progesterone receptors than normal uterine muscle cells do. So, when your body produces these hormones, they could stimulate fibroid growth. Next, we have genetics. Like many other health conditions, fibroids too seem to have a hereditary component. If your mother or sister had fibroids, your risk of developing them increases. Researchers are still working to identify the specific genes that may be responsible. Other factors include age and race. Fibroids become more common as women age, especially during the childbearing years. By the time they reach menopause, most women have had at least one fibroid. Moreover, African American women are more likely to have fibroids and at a younger age than women of other races. Lastly, lifestyle factors such as diet and obesity may also contribute. Studies suggest that high blood pressure, vitamin D deficiency, and a diet high in red meat can increase your risk. So, there you have it. While the exact cause is not known, these factors can increase the risk of developing fibroids. Remember, having one or more risk factors doesn't guarantee you'll get fibroids, but it does mean you should be more vigilant about your health. How can you tell if you have uterine fibroids? This is a question that many women may find themselves asking, and the answer isn't always straightforward. Uterine fibroids often come with a variety of symptoms, but the severity and type of these symptoms can vary greatly from woman to woman. One of the most common symptoms of uterine fibroids is heavy menstrual bleeding. This isn't just your typical heavy period. We're talking about soaking through one or more pads or tampons every hour for several consecutive hours. This can obviously be quite distressing, not to mention inconvenient. Pain is another symptom that's often associated with uterine fibroids. This can manifest as a persistent dull ache in the lower abdomen or as sharp, sudden pain during certain activities. The location and intensity of the pain can change depending on the size and position of the fibroids. Some women also report feeling a sense of pressure in the lower abdomen. This can feel like a constant fullness or bloating that doesn't go away with time or changes in diet. However, it's important to note that some women with uterine fibroids may not experience any symptoms at all. These fibroids are often discovered during routine pelvic exams. Remember, experiencing these symptoms doesn't necessarily mean you have fibroids, but it's always important to consult with a healthcare provider if you have concerns. So, if you're dealing with heavy periods, persistent pain, or unexplained pressure in your lower abdomen, don't hesitate to reach out to a healthcare professional. Your health and peace of mind are worth it. Now that we've discussed what fibroids are, their causes and symptoms, let's talk about how they can be treated. There's a spectrum of treatment options available for uterine fibroids, and they range from conservative management to medication, and even surgical options. The choice of treatment usually depends on the severity of symptoms, the size and number of fibroids, your age, and whether you're planning to have children in the future. Let's start with the conservative approach. This is usually the first line of treatment, and it essentially involves regular monitoring of the fibroids without active intervention. This could be an ideal option if your fibroids aren't causing significant symptoms or if they're small. Next, we have medication. Medications for fibroids work by regulating your hormones to reduce symptoms and slow down the growth of fibroids. Some of these medications include gonadotropin-releasing hormone agonists, which can shrink fibroids, and anti-hormonal agents, which can help reduce heavy menstrual bleeding. But what if medication and conservative management aren't enough? That's where surgical options come in. One popular procedure is a myomectomy, which involves the surgical removal of fibroids while leaving the uterus intact. This is generally a great option for women who wish to become pregnant in the future. Another procedure is a hysterectomy, which involves the removal of the entire uterus. This is usually considered as a last resort when other treatments have failed. Another noteworthy treatment is uterine fibroid embolization, a minimally invasive procedure that works by blocking the blood supply to the fibroids, causing them to shrink. Remember, every woman's situation is unique, and what works for one may not work for another. It's crucial to have a thorough discussion with your healthcare provider about these options to choose the best treatment plan tailored to your specific needs and lifestyle. While fibroids can be a cause for concern, remember there are many effective treatments available. With the right information and the right healthcare provider, you can navigate this journey with confidence and optimism. To recap, uterine fibroids are benign growths that can develop in or on the uterus. They're a common occurrence, and while they might sound intimidating, they're generally not associated with an increased risk of uterine cancer. We've talked about the potential causes of these fibroids, which can include genetic alterations, hormones, and even other growth factors. The symptoms can vary widely, from heavy menstrual bleeding and pelvic pain to frequent urination and lower back pain. However, it's important to remember that some women may not experience any symptoms at all. As for treatment, there's a range of options available, from medication to manage symptoms to surgical procedures for removal. The choice of treatment is largely dependent on your individual health condition and personal preferences. Remember, knowledge is power. By understanding what uterine fibroids are, you can take control of your health and make informed decisions. Thank you for watching, and remember to consult with a healthcare provider if you have any concerns.